Hello and welcome to another episode of our Hispanic Heritage Month video series. Today we're thrilled to bring you a powerful conversation on leadership and its role in advancing mental health equity for the Hispanic community. I'm Daniel Perez, and in this episode we'll explore how leaders at the center are tackling health disparities and ensuring that mental health care is accessible, equitable, and culturally competent for Hispanic individuals. Joining us for this insightful discussion are Andrew Estrada, Vice President of Crisis Response, Juanita Rodriguez Cordero, Vice President of Clinical Outcomes. We'll hear personal reflections from Andrew and Juanita on how their cultural identities shape their leadership styles and their vision for the future of mental health care at the center. This is an important and inspiring discussion on the role of leadership in making mental health services more inclusive and equitable. Andrew and Juanita, are you ready to dive in?
Sure.
Let's go.
Awesome. So what is the role of leadership in recognizing and addressing the unique challenges Hispanic individuals face when accessing mental health care?
Well, the biggest hurdle is just getting Latinos or Hispanos to seek treatment. When you look at the statistics, nearly 65% of individuals who are experiencing mental health issues will not seek treatment. So you're looking only at let's do the math, about 35% that will actually go and seek treatment. There's a lot of barriers that prevent someone from going in. And being in San Antonio, part of the challenge is that individuals are coming here and an immigration status might be something that prevents them from seeking treatment. They're afraid of being deported or having to report that they are not here legally. There's also things as simple as transportation. Someone can't get from point A to point B, or they have to make decisions about if they have health insurance coverage, do I have the money that month to be able to make my copayment? And there may be a decision between, do I feed my family or do I go to the doctor? And oftentimes they're going to choose their family and the care because that's typical of Latinos, especially female Latinos, where they will put everybody else before themselves.
Absolutely. I'll continue on that line of discussion. And so what we have found and what we see in our Hispanic culture is that, one, as leaders, it's important for us to recognize that there is a disparity, to verbalize that disparity, and then as leaders to understand that within the Hispanic culture, we see that there's an increased rate of anxiety, of depression, of PTSD, substance use and alcohol use, and then also an increased rate of suicide. So kind of working off what Juanita said, we also see that there's, specific to the Hispanic community, the rate of individuals that are seeking help is even lower. So one study in 2001 found that if you look at the non-Hispanic culture, individuals, that they will actually seek help at 52%. So the non-Hispanic, or the Hispanic culture, by conversely, will seek help at a 32% rate. So there's an obvious gap within the Hispanic community that to go out. And Juanita mentioned several of those barriers. But I think as leaders, it's important for us to recognize that there is this disparity, to verbalize it, and then to actually take action to make that better.
Juanita, you talked about immigration status and undocumented individuals. How does the center handle that situation? Like, can you ease the fears of those individuals? Like, can you expand on that a little more?
Sure. We are not required to report a person's immigration status. And the only thing that we require as the local mental health authority is that the individual resides in Bexar County. So, and we don't even require that they provide proof of that. They can simply come up and during the enrollment process say, I live in Bexar County, and give an address, and that's it. We don't ask that they provide proof. We will ask if they have it provided to us, or if they have a driver's license, things like that. And if they don't have those documents, then we have the ability to assist with that. We see individuals regardless of their ability to pay. And then when they do or are enrolled in treatment, we can work with them to help them find funding for the services or for the continuation of services.
Awesome.
And looking at immigration from the crisis perspective, when someone calls 911 and they're needing help, whether it's in the city or the county, our response from the center, along with public safety, both fire and police from the city and the county, we're going to respond. And so you're going to receive the same treatment and the same level of care, whether you're an immigrant or not an immigrant, whether you live in the city or not. And as Juanita mentioned, as long as you're able to tell us an intersection you live at or an address or anything within the county or in the city, we're going to treat you and we're going to make sure that we get you to the assistance you need, whether that be a medical facility, a psychiatric facility. We're going to respond and make sure that you get the assistance that you need.
Awesome. Thank you. That's really important. I know a lot of people are afraid of that, especially with this day and age where being undocumented is can be controversial at times with certain communities.
Yes.
Right.
So that's important to know that the center does not report out like if someone is undocumented.
Yeah, the fear of deportation is real. And so you'll see that within the school systems and in the center to make sure that whether your children need help, we are not going to go and have somebody deported because you reach for help. So that's just, across the board. That's going to be a standard that we're going to uphold, that is not, there should be no fear to call and reach for help for any of the services that the center provides.
How important is ongoing staff trainings for both teams about cultural awareness? Can you all expand a little on that?
It is critical to a person's recovery to understand their belief system, to understand who they identify as their family, especially when you're talking about Latinos or Hispanos. When you're talking about that particular culture, that is very important. So religion or their belief system, that is important. Whether or not you are Catholic or Jehovah or whatever, you need to understand where it is that they're coming from and know that some of that plays into what will help them move forward in their recovery.
Absolutely. Those treatment plans are very important in understanding culturally, as we'll see within our community in San Antonio and Bexar County, that it's not uncommon to have a household that has multiple generations under one roof because our Hispanic culture and our heritage is to be very, very tight-knit. And so it's not uncommon to have a grandchild live with a grandparent and have a very tight relationship. So as we look at those cultural norms and the value systems and practices. As I'm sitting here listening, I'm thinking of my grandmother that when I would get sick, we'd bring out the egg, we'd have the okra, right? So we'd go through that and she'd put it under the bed, right? And that was just growing up, that was normal. And so we would know very well if we're getting sick, we call her Chacha, Chacha's going to come over and she's going to help with us, right? So all these things would be very abnormal to someone who didn't grow up in that type of environment. So as we look at the plans that we're making and how we're approaching the individual in that home, to understand that it's about person-centered and what they want, but we have to also be realizing that the needs of the family are going to be really intertwined because they're very tight-knit. So it's a very unique culture that is very, very proud of its heritage, and one that we see that's very tight together.
And you'll have better treatment outcomes if you involve the family, and if they have a voice, it'll help things.
So I've noticed from just the episodes that we've done so far, children's behavioral health, IDD, it's all about incorporating the family into the care. So that's what I really love about the center, is that it's not just focused on that one consumer. We involve the family and we make sure that the family has kind of a say in what's going on, and we teach the family how to help that individual. So what are the barriers that we've talked about language, we've talked about the stigma, we've talked about undocumented individuals and how that can prevent someone from accessing care. But going into crisis, what are some of the tailored services that crisis response has to help those Hispanic individuals?
So the center does a good job, like many organizations, of really trying to recruit individuals that are bilingual. We pay a stipend for that, and that's important that we value enough that we're going to pay extra to try to recruit someone who speaks Spanish. So language is a huge plus, a huge barrier that we are doing a good job about trying to overcome. Transportation is another one. So the center has different services that provided to assist in transportation to and from, and we partner with other transportation agencies to be able to provide ways to get here through bus or another way. In the crisis realm, we also partner with law enforcement and fire. So we have multiple programs that have been designed specifically to look at individuals who are in crisis at the moment. And so typically, I can tell you, having grown up and just living in the Hispanic community, that there are times where you have that Theo he's kind of loco, he's kind of does his thing, and he self-medicates, and he's been through Vietnam, or he's been through my much older family that might have been through World War II. They came back with a lot of scars and PTSD, and our culture really worked to say, we just kind of left that alone. And especially, from the male, the macho, the male machismo is a real thing. And so being able to say, I'm a leader in my family, I'm the father of this family, and I can't admit that there's a problem. And so I'm going to solve that through self-medication or isolation or maybe making it difficult for the family at times. And so that's a huge barrier for us to overcome. So I think it's important that what we're offering in crisis response is immediate help. And so whether you're working through and you need assistance, to call 988, which will route through a federal service back to the Center for Healthcare Services, which will elicit a response to your home. So whether it's 988 or more traditionally, if you call 911 and you're in crisis and you have somebody who's having a lot of difficulties or potentially looking at potential suicide or hurting themselves or somebody else, we want you to call 911. It's a system that everybody's learned, that we is very well known to call 911, and we can piggyback off that system that's worked for years to say we're going to show up very, very rapidly to assist you and to try to give you alternatives and to resolve, if we can, to help you on scene. So our number one goal in our crisis response teams is to see if we can help you. We might be there for 3 hours. So if we can get there and help you to de-escalate and find ways to work through that situation while we're enrolling you in services for longer term, that's important for us. And that's our number one goal.
What are some ways, like outreach strategies or potentially maybe new technologies or goals for expanding services for the center to ensure long-term sustainability for competent care?
Well, accessibility is one of a few barriers to treatment, and so the center is looking at what we can do to increase our footprint across Bexar County, and looking at those areas where there are where the folks that are coming to us currently, we're looking at those zip codes and trying to figure out where is there an opportunity to open up access. So whether that be looking at opening up a new clinic to help people access care more quickly. We're looking at what we can do to improve treatment outcomes in general. So now talking to our clinicians about those things that we've been mentioning, those social determinants of health, those things that are the non-medical factors that impact a person's overall well-being. And so it's trying to teach the organization about that. Andrew mentioned the suicide rate for individuals that are part of the Latino or the Hispanic population. It's offering those trainings to our community so that they can learn about how they can help their loved one or someone that they see that might need assistance, and to be able to prevent that suicide from happening.
I'll expand on that as well. On the crisis side, we're doing more with technology. So one thing that we are seeing that's been successful in several of our teams is the utilization of telehealth. So one of the things we can do if you're in crisis, if we can get to if you can call a number and talk to somebody through 988 is very good. If we could send you a link and have you talk to us face to face is even better. And so we are currently using this technology within some of our teams, the SA core team within the city and the SMART team within the county. So there are times if there's not a mental health clinician available to show up to your home that we are utilizing telehealth. And so that has been our goal is to increase that to where maybe make it easier. I know that there are thought processes within the city to change the 911 system to have where you call and you can ask for fire, police, EMS, or mental health. And so that's a down the road addition that hopefully we can get to in the near future. But the goal would be to have a way to communicate live with somebody that's the clinician that's certified with the Center for Healthcare Services, that we can start working individually face to face. On the crisis team, it's very helpful for us to be able to start that call immediately. So especially in the county. The county's a large geographic area, so sometimes it might take a while to show, especially if you're in traffic time. So you're trying to get around 1604 at 5 o'clock, it's going to be difficult. But if we can send you a link, or we can talk to you through a teleconference, we can start that communication. We can look at the environment, understand what else are we going to need available. So is there something else happening on scene that warrants us to get more resources on scene ahead of time? So these technologies are coming, and we're starting to utilize them more often.
Can y'all talk about how growing up in the Hispanic community has changed your view on mental health? Because I know there was a lot of stigma where we don't talk about it. We don't involve people outside of the family. So how has that changed your view, and how has that influenced your leadership styles and your commitment to serving the Bexar County community?
It's important to understand where you come from. Certainly, I've grew up in a time period where, talking about mental health and discussing your feelings, especially as an adult male in Hispanic culture, was really taboo. You don't do that. Mental health in the Hispanic community that I've experienced personally is real. It's a situation that is very dear to my heart. I understand that for us to get better, we have to be able to talk. We have to be able to share. We have to be open to allowing individuals to say, I'm having difficulties. I need help. I would argue many times with individuals saying, look, you might think that you're being a man by managing on your own, but it takes a much larger, much bigger man to say, I need help. And the outcomes of saying I need help are much better. As a leader within the fire service, now a leader at the Center for Healthcare Services, that I too will go ask for help. And it's important to say that I have no problem, and part of my leadership in surviving and being able to get to this level is by saying, I need to go on a regular basis and seek help. And things that are happening in my life that I don't just swallow and hold down, I need to go get help. I need to go get those out on the table. Let's deal with those things, and let's work through previous trauma. Let's work through stress that are happening today. And that, as a leader, that makes me stronger.
Growing up as a kid, it was interesting because I spent most of my summers I don't even remember how many weeks at a time our parents would take us to Mexico. And so we would be dropped off, and they would come back home and leave us there with our aunts and uncles and stuff. So it was interesting to learn about the perspective from the Latinos that are living in Mexico, because they saw us as we weren't true Mexicans because we were from America. We were from the United States, even though we're Latinos. And so it was growing up and watching their thoughts and their beliefs, and then coming back home and seeing what it was here. And so it was really interesting. So much like Andrew said, you didn't talk about mental health issues within your family. We all had that one person, cousin, uncle, aunt, or someone that everybody would say was está loco. They're the crazy one. And you circle the wagons, everybody gets around that person, and we as a family take care of them. You don't take it outside. What is that? You don't air your dirty laundry kind of thing. We do what we can to take care of them. And that's unfortunate because a lot of people then go without treatment and go without the help that they need. And so looking at the Hispanic population and what we need to do to help educate them about mental health treatment, substance use treatment, we've got a long way to go. And we still don't know what the effects of the pandemic will be. Those will be challenges that we'll be faced with. And I think that comes across all cultures. It's not just Hispanics or Latinos. And it's doing those kinds of things, trying to get ahead of it, and understanding what we as mental health professionals need to do, how we need to adjust our practices to be able to reach more people who are in need of treatment. As far as how that has impacted how I lead, I think because of the way I grew up and the strong family connections that we have, I tend to treat the folks that I work with as my family. They are my, and I know sometimes people say, no, you don't have family at work, but I try to be very collaborative with them, and I try to take it from a point of view that I know that you have things going on in your life, and some days you may not come with your A game, and that's okay, because I'm going to be right there, and I will pick up the slack until you can get back on your feet. And it's not a matter of, well, I'm the boss, and you have to do all the work. No, I'll get in there with you. I'll do the work. I'll walk alongside you, and then we'll move forward together. And so we work as a team, and it's a team effort, and that's how we're going to make an impact.
Thank you for participating in this little chat.
Thank you for having us.
I really appreciate it, and thank y'all for watching.
Thank you so much.
Thanks.